that mobile phone apps can be a great way to help patients remember to take their medications. There are some people that are going to find it really, really helpful to have an app on their phone that reminds them to take their medications. And when you've got oral anti-cancer medications, adherence is so, so, so important.
I have so many questions. Let's start with, I have a very cool guest with us today. I have our very first Oncology PharmD as a guest here. Megan, thank you for joining us.
Thank you so much for having me. I'm excited to be your first Oncology PharmD. I hope that just like oncology pharmacists across the country, I will integrate this care team and inspire all of your patients listening to ask for their own oncology pharmacist too.
All right. Okay, we have to start there. Sorry. Tell us what an Oncology PharmD does, is pharmacist. Give us
Yeah.
give us the rundown.
So an oncology pharmacist is a little different than your run-of-the-mill pharmacist. I love my colleagues in community pharmacy, but we tend to handle the trickier stuff, right? All the chemotherapies and supportive care medications. So oncology pharmacists, like all pharmacists, have a doctorate degree. So we do our prereqs and then we do a 4-year doctorate program to get our Doctor of Pharmacy. And then we have the option to do additional training. So I did 2 additional years of residency, and my second year of residency specialized just in oncology training.
Wow. So you're an overachiever.
I'm an overachiever, but it's allowed me to be a great oncology pharmacist. And you'll find oncology pharmacists in a variety of settings. So obviously in cancer centers where they're part of the infusion pharmacy process and overseeing verification and safety of those medications that are going out to patients. But you'll also find them, as we'll talk about, in oral chemotherapy clinics or in other direct patient care settings where they're a part of the patient care team and they're handling a lot of the monitoring of medications, educating of patients. You can also find pharmacists at specialty pharmacies who specialize in oncology medications. And then the last place people will see if they end up in the hospital. So a lot of patients with cancer end up requiring inpatient care, and they might encounter an inpatient oncology pharmacist. And so there are pharmacists who are handling the medications there. They're particularly important on the bone marrow transplant wards.
I was going to ask you that. So bone marrow wards, where else? Because I'm hearing bispecifics, heme. Anything there?
All of the above. So yeah, bone marrow transplant is incredibly important because those medications are so serious and they require a lot of pharmacokinetic monitoring. So trying to understand how much drug the patient needs because based on patient's metabolism, that can vary widely. You mentioned bispecifics. That's a newer class of drugs that's being used and carries a lot of side effects. And so pharmacists are very important in making sure those medications are handled appropriately, are compounded the right way, because they may require special infusion rates or require a pump so that patients can wear that medication and take it home with them and be infused for several days. Other places you might see pharmacists, other new therapies like cellular therapies. So pharmacists have been very involved in handling patients who are receiving some of those new cellular therapies, and especially when it comes to managing the supportive care medications. So making sure that the antibiotics are correct, that the immunosuppression is correct, that if they have side effects, that those medications are being delivered appropriately. Pharmacists are behind the scenes on all of that.
Wow. Okay, so you said something here that I got diagnosed in 2020. I don't think I realized oncology. This sounds really naive. It is naive. I didn't even realize oncology pharmacists existed until about a year ago, because I feel as though there's a lot of behind the scenes stuff. So can you talk about that? Like, where in the patient experience does the oncology pharmacist go from like behind the scenes to someone the patient actually interacts with?
That's such a good question, Samira. And I will tell you, I work with several pharmacy organizations. I'm very active in oncology pharmacy groups. And so this is a passion from me, trying to make sure people know that we exist and that we bring this expertise in medication management that is a great benefit to the oncology care team. As you say, a lot of the work the oncology pharmacists do is behind the scenes. So it's in the infusion pharmacy, it's managing those bags of chemotherapy. But in a lot of cancer centers, particularly larger academic centers, but we're seeing more and more in community sites and smaller sites that pharmacists are taking a role there as well. We'd love to see more pharmacists up front in the room with the doctors and the nurses when patients are having conversations about their treatment, because I think that there's certain things that pharmacists can add when we're talking about, how frequently is a medication administered? What side effects does it have? Is it contraindicated with other medications? Things like that, that other groups in the healthcare team may not be as prepared to answer those questions. Like, I love the medical oncologists that I work with. They have such deep expertise in chemo, but they don't have deep expertise in other conditions like cardiology and diabetes and things like that, that patients with cancer also have. And so a lot of times the pharmacist ends up being the one who's helping to say, okay, let's start this frontline chemotherapy drug or this oral anti-cancer agent, but hang on, that's going to interact with the patient's blood pressure medications. So let's go ahead and have a conversation with that team about the next best blood pressure medication, so that we can make sure that the patient gets the frontline chemo, but also doesn't have a stroke because of the chemo.
Oh, that's such a good example. Okay, naive question number. I don't even know what number we're at. So it sounds like the pharmacist in the oncology care setting is sort of almost playing, for lack of a better word, the glue
I
in
mean,
care settings, not care settings, comorbidities.
yeah, I think sometimes we can be the glue. I definitely don't have super deep cardiology expertise, but I at least know enough to know when we're going to have a drug interaction that we need to be thinking ahead about, right? And so we can be the ones that are corresponding with that team, or at least alerting our team, like, hey,
Yeah.
you need to get in touch. I always think of the MDs as sort of the quarterbacks of the healthcare team. But definitely the nurses, the pharmacists, the nutritionists, the social workers, they all have important roles on the healthcare team. And I think for patients, especially patients who are newly diagnosed and who are trying to understand like the journey that they're about to start on, and all the people who are going to be a part of their care team, they should feel empowered to ask about that. Because in the settings that I've worked in, like having a nutritionist as part of the team was instrumental. Like having social work when we were dealing with medication expense issues was instrumental. And yes, I think the pharmacist is very important. I don't know if we're the glue necessarily, but I think that we bring an expertise in medication. We call ourselves jokingly the chemists of the healthcare team. And I just don't think that anybody else really has that deep of an understanding of how medicines work and how they interact.
Very cool. I am walking away already learning something. That's amazing. All right, we're gonna switch
Okay.
ish. So you read a Picori report, not report, a study, Picori sponsored study. Can you tell us what it was in high level, and then what your biggest takeaway was?
Yeah. So, Samira, you asked me to read this study that was called The Randomized Trial of a Smartphone Mobile App to Improve Symptoms and Adherence to Oral Chemotherapy for Cancer. And I loved this paper because it hit on two of my favorite topics, which is number one, oral chemotherapy, since that's where I started my career as a pharmacist, but two, digital health technologies. So I loved this intersection. And my big takeaway on this paper was that mobile phone apps can be a great way to help patients remember to take their medications. I can tell you as a pharmacist, like, no two patients are the same. Everybody has different things that will be helpful to them. But what I took out of this paper is there are some people that are going to find it really, really helpful to have an app on their phone that reminds them to take their medications. And when you've got oral anti-cancer medications, adherence is so, so, so important.
I have so many questions. Let's start with oral anti-cancer medications. Just tell us what it is and
Yeah.
why we're seeing sort of a higher uptake rate of more drugs like that come to market.
Yeah. Why are we hearing about them more and more? I love it. Um, so I'll use the terms oral chemo and oral anti-cancer medication interchangeably. But really, I mean, I guess if you wanted to be a stickler, chemo is cytotoxic medications. And, we think about classic chemotherapies like cyclophosphamide or paclitaxel. Um, but the word oral anti-cancer therapies is a little bit broader, and I think it encompasses more of what we're talking about and more of what they included in this paper. And so it's oral medications that can include chemotherapy, like there's an oral version of cyclophosphamide. It can also include newer targeted therapies that target specific protein mutations that occur in cancers that are driving that cancer. And they can also include hormonal therapies. So agents that are hormones or impact hormones that are feeding cancers. And so when I talk about oral anti-cancer therapies, I could be talking about any one of those, but really any therapy that a patient is taking that's directly affecting the cancer that they've been diagnosed with.
Okay. And why are we seeing such a explosion?
Yeah, so in the last 30 years or so, we've seen so many new agents approved. And a lot of it is these targeted therapies. And so that was sort of how I got into oral anti-cancer therapy work, was that when I graduated from pharmacy school and when I finished my residency, there were more and more and more of these targeted therapies being approved. And you can recognize them because a lot of them and their drug names end in nib, N-I-B. So like imatinib. And these are a class of drug called tyrosine kinase inhibitors. And in some cancers, tyrosine kinases, which are proteins, have gone awry. They've had some type of mutation, and they're what scientists would call constitutively active. So they're a light bulb that's constantly turned on and cannot be turned off. And it's driving the cancer to grow and grow and grow and grow. And so we can deliver these oral tyrosine kinase inhibitors and turn off that switch. And as I say, many of them have been produced or discovered and studied in the last 30 years or so. So imatinib was the very first one that was approved. It was originally used in chronic myelogenous leukemia. It has a whole host of indications now, and we have a whole host of tyrosine kinase inhibitors that have been approved. But they've really changed the landscape for a lot of cancers, right? Because instead of having to come into an infusion center to get your medication, you can take it at home. So it's really changed things for patients, and it's really changed frontline treatment for certain cancers, because we used to go straight to chemo, but now more and more we're seeing that if we target these altered cellular pathways, we have a different way to reach the chemo or to reach the cancer. Instead of just this kind of nuclear bomb approach with chemo, right, where you try and destroy everything and hope the healthy cells grow back first. In this case, we can really target the cancer. Now, I have to say that doesn't mean that there's no off-target effects. These drugs still have side effects. They still require a lot of monitoring. There can be very unusual toxicities with some of these, and that's why we do need to make sure patients understand what they're getting and how to take it and when they need to come in to have lab tests done. But yeah, in the last 30 years, I think we've gone from 0 to, gosh, probably about 100 at this point of these targeted agents. And, if I had to do the math and tell you how many oral anti-cancer agents there are total, including hormonal therapies, chemotherapies, and targeted agents, it's probably close to 200.
Wow, I did not realize that. That's almost like 2/3 of all anti-cancer treatment.
Yeah.
Whoa. Okay, I didn't realize that. So the paper starts to look at the paper, and then in general, actually, I feel as though it's going to straddle for me, and my data may be dated. Ha, no pun intended there. But when I looked at adherence rates in oncology, I think it was a while back, maybe 5-ish years ago, which is why I think it's dated. I remember adherence being actually pretty high.
Mm-hmm.
And I remember it being only, I think about what, I think the number I remember was 10% of patients are not adherent to treatment. So are you seeing, just broadly speaking, before we talk about the paper, are you seeing that change given the explosion of number of oral anti-cancer treatment options?
Yeah. So I can speak kind of anecdotally from my own personal experience running an oral chemotherapy clinic. Adherence rates in general for patients with cancer are quite high, as you say, especially when we start comparing to other chronic conditions. And I think, frankly, a lot of it is that cancer is so scary. I think cancer is a big motivator for people, right? When you have that diagnosis, you want to take your medications. You want so much to be helped by those medications. So, frankly, when I was in clinic, I didn't have many patients who were non-adherent. And in fact, I even had some patients who would try and call for refills sooner because they were taking meds more than they needed. Like they were supposed to have an off week, but they would skip it. Or instead of spreading their meds, like instead of taking 4 pills in the morning with breakfast as prescribed, they'd like take it 1 pill throughout the day. So they would try and have more consistent coverage. But let me just say, for the record, patients, please take your meds as prescribed. There are reasons that these medications are administered the way that they are. They've been very carefully studied. And you're probably going to get the most benefit from it if you take it the way it's prescribed. So yeah, it was really tough when we would have patients who would be like, but I don't want to take an off week. I want to keep taking it. But that's just not always safe. So we want to make sure patients are being adherent. And before we go farther, I feel like we should talk about what adherence is. So that's a term that gets thrown around by medical providers. Sometimes it's called compliance as well, but that's more of an older term and sort of dates back to like the paternalistic times of medicine. So we use adherence now. I think it has less of a sense, like a connotation of blame than compliance did. But adherence is simply how many pills did you take when you were supposed to take them, right? So over the course of a month, let's say you have a medication you're supposed to take 3 times a day for 30 days, that's 30 pills. Did you take all 30 or all 90, I should say, 3 times a day? Yeah, 90 pills. Did you take all 90 or did you skip a couple? Like, are you at 85 out of 90? That's still pretty good. So I would say, yeah, in terms of like the trend over time, I think the message is getting out, especially with these newer targeted therapies, that adherence and taking your medications on time as prescribed is very important. And it's tied to outcomes. So we're not just saying like, please take your medicines just for the sake of take your medicines. It's because we have studies, many studies that show that missing a few pills can actually decrease patients' rates of staying in remission. And we want patients to stay in remission, or we want them to stay disease-free. And so it's very, very important that they take their medications as prescribed. I know no one's perfect. I'm not perfect. Patients are going to miss medications, but it's important. And we'll talk about how this paper sort of adds to the literature here of different ways to keep people on schedule and give them techniques for remembering to take their meds.
So maybe we should do that. Why don't you? You want to talk about the app and the features and how what they designed to do that?
Yes. So in this paper, it was a group from Dana-Farber Cancer Center in Boston, and they designed an app, a mobile app for iPhones and Androids that would provide reminders for patients about taking their pills. So the app actually had a few different features. So one was it had a personalized medication dosing schedule. So when patients were first enrolled on this study, they met with their healthcare team and they got an introduction to the app, and they were able to load in their medication and their dose and schedule. It also had a reporting module. So once a week, patients were notified to go in and enter how many pills they took. So what was their adherence, and were they having any side effects? And all of this information was emailed to their doctor. It also had an educational resource module, so a library where patients could go for information on symptoms and other cancer topics. And then the last thing that I thought was really interesting was it had a Fitbit integration. So for patients who wanted to sync their Fitbit to the app, they could do that, and they could set step goals and activity trackers. I was disappointed, honestly, that the authors didn't comment on the success of whether they got people to be more active. But those were the features of the app. They enrolled about 180 patients. I think it was 181 exactly. 90 to the not mobile app group and 91 to the mobile app group. And for 12 weeks, they had one group that just had standard of care. They got their usual medical appointments and counseling about the importance of medication adherence, but no additional interventions. And then the second group was invited to download that mobile app and participate in the weekly check-ins and the information that was provided there. All the patients enrolled on the study, all 181, also received special pill bottles that had a cap with electronics embedded in it so that the researchers could see exactly when the pill bottle was opened. Now, I can tell you as a pharmacist, like, this is the gold standard of running these types of studies, but there are ways to game it. Like, patients could still open it and not take a pill, right? But for the most part, I think this was a great way to do the study. Very good research, very good science that they put into designing this study.
And what did they find?
No difference, honestly, which I think was disappointing to the researchers. But I think there's a few lessons we can take from that. So one, it was a small study as far as oncology studies go. So 181 patients is a pretty good number, but still it's not huge. And it was all from one center. So there wasn't a lot of diversity. It was a pretty homogenous patient population. It was a lot of middle-aged white people, mostly affluent because of where that center draws their patients from. So it's hard to draw conclusions outside of this group. I think what they had was they had a group of patients who were excited to participate in the study, were already sort of likely to be adherent. And so it was hard to tell a difference based on the intervention of this mobile app. But I think the next question you're going to ask me is, well, isn't there anyone in that study? Are there any subgroups where it made a difference?
Yes, I was going to ask you that question.
Yes, Samira. There were. So there were two groups that when they sort of looked more deeply at their data and asked themselves, like, well, is there any benefit to this app? They found two groups that stood out. And one group was patients who had self-reported adherence problems based on their baseline screening. And they used a test called the Mariski Medication Adherence Scale, which is a very short 4-question scale to assess patients' medication adherence. So patients who, from the beginning, had sort of self-identified they might struggle with adherence benefited from the app. The other group of people that benefited from the app were patients who had symptoms of anxiety, and this was measured on the Hospital Anxiety and Depression Scale, or the HADS scale.
Can you talk about whether the study talks about it, or if you have any hypotheses as to why these two subgroups?
The authors didn't really go into a lot of detail about why they thought that these groups benefited particularly, just that they noted that these groups had benefited. I would say, if I had to speculate, my hypothesis, Samira, is that these are groups that, well, one, kind of had more room to go, right? We talked about we had a group of patients overall that was already likely to be adherent. I think these were the folks within that group who were maybe less likely to be adherent, especially the group that already scored low on their medication adherence test. But I also think that when we think about the experience of cancer and the experience of starting on some of these medications that can be very intimidating, it's just a very disruptive and kind of chaotic experience, right? It's very scary. There's a lot of stress. And I think that having this mobile app gave patients in those groups, sort of gave patients who already had medication worries or just general anxiety, it gave them a reliable source of help and added a sense of control for them. That's just my speculation, but that's what I think made these particular groups statistically significant when we looked at their improvement in medication adherence rates.
Megan, can you talk about symptom management and as it pertains to the paper, the product they tested, and in your experience, how that relates to adherence?
Yeah, such a good question. So symptom management can be a big deal with these medications. As I mentioned, depending on the medication you're talking about, it can have a variety of side effects. Like I'm thinking just off the top of my head, there are certain lung cancer medications that have a lot of skin side effects, like some very bad rashes. Others cause bleeding problems or may cause blood pressure problems. We already talked about that. And so there's a lot of management that needs to go on. And even beyond some of these specific side effects, patients can experience just general things like nausea, lack of appetite, fatigue. These can all be problematic. So, in the paper, the authors described how they built a symptom tracker into their app. And each week, when the patients were alerted, for the patients who were in the app group, they were alerted to enter their adherence and enter a symptom survey. There were 17 different symptoms that they were asked about, and they had to rate how they were doing with each of those symptoms. And what I thought was really useful was that the information about their symptom rating was emailed to their physician. Now, unfortunately, it wasn't integrated directly into their electronic health record. And I think if we were going to talk about ways to improve this study, that's one thing that they could do differently. They just didn't have the capability to do that at the time that they designed the app. But it's great for the healthcare team to be alerted about patients' symptoms. I think one thing that I saw as a pharmacist in clinic is that a lot of times patients are concerned about bringing their side effects forward. They may think it's not that big a deal, I can just handle it myself, and so they don't want to bring it up. There's also a concern of, oh my goodness, if I tell my doctor that I'm having this side effect, they'll cut my dose or they'll take me off this medicine, and I need this medicine. So there is some hesitation, I think, about discussing side effects. And particularly when we're talking about differences between oral chemo and IV chemo, when you're on IV chemo, you're in the infusion room maybe once a week, and a nurse is laying eyes on you and talking to you. But when you're on an oral anti-cancer medication, you may not go into the clinic except every 3 months. Yeah. And so that's a long time for patients to sort of wait and say, it's okay, I can manage this myself. But when you've got a mobile app every single week that's asking you, like, how are you doing? Are you really tired all the time? Have you noticed additional bruising? How is your appetite? It really lowers the bar to, oh yeah, I have lost a couple of pounds. Like, I don't think I'm eating great. Maybe I should put that in. So I really love, as a provider, I think the mobile app symptom management is great. And I think outside of this paper, I think these patient-reported outcomes, as you might hear them called, are becoming more important. And we're seeing a lot of healthcare systems try and think of ways that they can communicate with patients outside of visits and get at some of the symptom management so that patients can understand they are not alone. They do not need to manage these themselves. There are ways that we can help with symptom management. There are, creams that we can apply to rashes. There are meds that we can help with nausea. There's all kinds of stuff that we can do. And it doesn't always mean that we have to change medications. Yes, sometimes we reduce doses or we change the schedule to make it a little bit easier. But you know what? If the patient's really, really not tolerating a medication, if it's making them sick or putting them at risk of having to go to the emergency room or go to the hospital, then maybe we do need to think about changing treatment plans and having an educated conversation about that.
Megan, that was such a important topic you just addressed. I can't tell you how often I hear that from our community. I hear it all the time. And I hear it across groups. I hear it from scientists and PhD candidates. And I hear it all the time.
Maybe it would reassure people to know that if you're ever having trouble sleeping and you want to open up a package insert for a medication with a teeny tiny print, you'll see that almost every medication has adjusted dosing schedules so that if there are side effects, we can drop down to the next tier and the next tier and the next tier. And we have evidence to support the efficacy and safety of those different doses. So while we may start at the highest dose, there are almost always ways that we can decrease safely to keep people healthy and out of the hospital.
I did not know that. And I look at PIs all the time. I didn't realize. And now that you say it, it's kind of like a duh moment. I'm like, yeah, duh. That's super cool. All right. Sorry, I made a note for myself because I was like, I should go and look. I want to go look. Okay, all right. There was something that you said that I wanted to sort of bring back to where we opened the conversation from, which was that hospital systems and health systems today are starting to build more capabilities to encourage patients to track symptoms and then report symptoms, because there is a way that we can safely adjust the dosing if we needed
Mhm.
to, and or support the patient to deal with the side effect. But I wanted to go back to the role of the pharmacist, because let me maybe tie in two more threads, and I'd love your take on it. If you look at oncologists, or primarily medical oncologists, surgical oncologists, or radiation oncologists, we're looking at a 15% reduction in the workforce this year.
Mhm.
Burnout rates are skyrocketing. We're looking at a group of individuals who are so well intended and truly like there to save lives. But if you look at mental health in that clinician group, the mental health of these clinicians isn't great either. So what I've also heard from clinicians anecdotally is, hey, I actually don't want my patient to send me more stuff because it's too much. There's too
Mhm.
much coming at me already. I can't actually take it. So I'm sort of curious to see how you think about the role of the pharmacist, because it feels like it's a under leveraged almost part of the care team that is incredibly knowledgeable, could sort of step in and take this portion of the cancer experience over. So anyway, I'm going to stop that. That was more of a thesis of the world and the state of the world right now than a question to you, but I'd love for you to comment on it.
I love the plug for pharmacists. I love that you just found out about them last year, but you're already 100% on the oncology pharmacist bandwagon.
I
Um,
really am. You guys are nerds like me. I appreciate that. I love the like detail on chemistry. It's great.
I love talking about drug mechanism of action. But pharmacists, as you say, are a great component of the cancer care team. And I think they have been missing, but we're popping up more and more and more. And as part of it is driven by the fact that there is a workforce reduction among medical oncologists and other MD specialties. Um, we're seeing some of that gap being filled by advanced practice providers, by NPs and PAs, but pharmacists certainly add an additional layer of expertise when it comes to medications. And when it comes to things like oral chemo adherence, um, pharmacists are very, very well situated, right? We are in the pharmacy, so we have access to some of the data like how often are we dispensing for this patient? Can we look at some of the issues that might be affecting adherence besides just patient lifestyle? Are we um, dealing with medication access issues in terms of is their medication affordable from their insurance, things like that. um, but even just being a frontline person when it comes to helping with symptom management and keeping patients on their medications as long as possible, as safely as possible. Yes, pharmacists are a great person. We do a lot of the upfront education for patients who are starting on these medications. And I think from my personal experience, when patients get the right education up front, you end up with a lot fewer problems down the road, because they understand how to take their medications. They understand what side effects are to be expected and how to manage those milder side effects at home. They understand what side effects are not to be expected or require attention when they become severe. So I think that already helps cut down some of the urgent phone calls doctors are getting off, like
Mhm.
outside of normal office hours. The other thing we haven't really talked about is the importance of digital health tools. So this app is a good example. And yes, the emails to the inbox of the doctors probably created a lot more noise. But one thing that I've been hearing at a lot of conferences I've been going to in the last few years is utilizing technology to try and triage some of the messages from patients and to try and standardize them. So you're not just getting a whole flood of in basket messages from patients, hospital lab app, but you can actually make sense of the information. Have a standardized list of symptoms, have a standardized way to rate those symptoms, and then that allows the technology to escalate certain symptoms and certain severities for urgent care, and then allow the other ones to maybe, I don't know, have a chat bot text back to the patient and say, here's some at-home management suggestions. Please bring this up at your next appointment, because sometimes that's all that's needed.
That was I love that you went there, because I mean, I think you know this. I definitely agree with that approach, because I think the tooling for patients is pretty much lacking today, and
Mm-hmm.
you kind of are the whims of Dr. Google and ChatGPT and pick your flavor of like AI tool, but that is not under the guidance or umbrella of oversight from a clinician. And I think that's what's missing right now from a patient perspective, because you get this information, you're like, I don't know, should I drink the ginger tea or not? And there's this like weird back and forth of like, will it really help me? Will it not help me? Will it hurt me? Etc. So I appreciate you saying that. I'm watching the clock, and I'm realizing that you and I can probably talk about this stuff for forever. Maybe just to like wrap up, if you had to make a plug for the future, so 5 years out, and magic wand, anything is real. You cannot cure cancer. Sorry, cancer can't go away. Unfortunately, I'm sorry. Um, what do you want to see be different?
I want to see a lot better integration of all the different systems. I see too many patients who have a radiologist in one health system and a medical oncologist in a different health system and a specialty pharmacy that they get their medications from, and none of these systems can talk, and the patient doesn't know who to message. So I would love to see a lot more transparency in our technical ecosystem so that all of these different systems can talk and they know when the patient had certain procedures, if there's been a delay in their medication, if the patient is having a side effect, that this can all be in one place. Where I practice right now, I was just reviewing patient charts the other day, verifying chemotherapy, and I could not for the life of me find the patient's EKG. I looked in the cardiology tab, and I looked in the chart notes, and I looked everywhere. And I finally had to call the nurse and say, where is the EKG? Like, I can't release this medication until I verify that the EKG is appropriate. And the nurse said, oh, well, it's in the media tab. It's just a PDF loaded up among millions of other pictures.
I have so many comments to that, and I'm gonna hold my comments. That sounds. I know I've had to do that from a patient perspective, but I can't imagine having to do that for many patients. I would lose my mind.
So that's what I want, Samira, is I want all of these things to be able to talk, and I want the patient to be able to access it too, because patients should be able to see all this information. They should be able to get the important pieces of care so that when they talk to their radiologist, they're having the same informed conversation as they are with their, nurse practitioner at their cancer center.
Megan, I've asked this question to a good percent of our guests. I have actually never gotten this response, and I when you responded with this, I had this kind of bemused feeling, because this has been a problem in the industry for 15 years now. I mean, like forever. Like this is something that's been an issue for such a long time. And I can't quite believe we're sitting in 2025 and we still haven't cracked it. And it's anyway, I'm feeling
Well,
a bit.
let's circle back in 5 years and see where we're
Got it.
at.
Okay. I'm a very generally optimistic person. On this specific one, I'm like, yes, maybe the AI gods will, come in and magic wand this for us. All right, last question for you, and then we'll call it a wrap. For a newly diagnosed patient, if you could give them one tip, what is it?
Well, you're interviewing a pharmacist. So my one tip has to be keep a medication list. And I don't just mean the names of your medications. I mean the name of the medication, preferably both brand and generic, the dose that you are taking, because as we talked about, it can change, and the frequency, what time of day are you taking it? Because too often patients come in and they don't have a list at all, or they have a list, but it's just the name of the drug, but I don't know when they take it. I don't know what dose they're on. And all of this is very important if we're managing a side effect or if a patient is coming into the hospital and they need urgent care. So I would tell people my number one pharmacist tip is please keep a list of your medications. If you have an app like the people in this study, that would be amazing. Keep it in your app, keep it updated. But even if it's just on a piece of paper, which honestly can be very helpful, like if you are in an accident or otherwise incapacitated and can't open up your phone to share with a nurse, please have a list of your medications. If you have someone who's taking care of you, make sure your caregiver or other family members have a copy of that list as well, and please keep it updated.
That was incredible. Thank you. I appreciate you. I appreciate you being a guest on this podcast. I cannot wait to have more conversations about chemistry with you. And thank you, Megan.
Thank you for the opportunity to read this study. I thought it was a great read, and I love seeing all the new innovations that are happening in cancer care and all that we can do for patients.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.